Hello and welcome to today's presentation. Today, I'm thrilled to delve the intimate realm of psoriasis, a chronic cutaneous disorder which constitutes a serious condition faced by millions of people across the globe. The aim of this presentation is to supply a detailed picture of what psoriasis is about, including its pathophysiology, treatment types, as well as requirements of the patients who have the disease. Aside physical distress, psoriasis also has a profound effect on the emotional health and social relationships. I believe by the end of this presentation, you will have learned key insights into how to manage the illness successfully and assist the people that are affected by it. Let's start this journey to unravel the complexities of psoriasis and see how we will address the needs of those suffering from the disease. We will begin by understanding the definition and prevalence. We will then look at the types of psoriasis, and next, we will discuss the pathophysiology and the skin's anatomy. We will then look at the physiology of normal versus psoriatic skin. Next, we will delve on clinical manifestations followed by diagnosis and differential diagnosis. Last but not least, we will look at treatment approaches. And finally, we will tackle on patient needs and support. Psoriasis is more than simply a superficial skin disorder, but rather a complex autoimmune condition that afflicts people in many parts of the globe. That's according to Campanati et al. Writing in 2021. It presents with an increasing number of skin cells which form thick, red patches covered in silvery scales. As to prevalence, psoriasis is quite widespread, with about 2 to 3% of people in the world have it, according to Edgebird et al. Writing in 2020. Onset can occur at any age, but it is most commonly identified among people aged between adolescence and middle age, usually presenting before the age of 35. Psoriasis manifests in multiple forms, different in their presentation and symptoms as indicated by Valle and Nakpure, writing in 2022. Plaque psoriasis is the most common variant, which is characterized by elevated red rashes covered with silvery scales. This condition usually presents itself on hands and legs, elbows and knees, on the head or scalp, and the lower back. Glutate psoriasis might display small, red dots similar to drops, which are frequently a result of bacterial infections like streptococcus. Moreover, psoriasis has other types like inverse, pustular, and erythrodermic, with specific features that make it hard to diagnose and manage these types of psoriasis. Understanding these different types is crucial for accurate diagnosis and appropriate treatment planning. The pathophysiology of psoriasis is multifaceted, with both genetic disposition and environmental factors having triggering roles as well as the immune system dysfunction, according to Yamanaka et al. Writing in 2021. Genetic components are important, as some gene variants heighten the chance of psoriasis. These triggers such as stress, infections, and medications can worsen the condition or induce the psoriatic flare-ups. The immune system dysfunction is central in the development of psoriasis, and it mainly involves T cells and cytokines imbalance. Such imbalance triggers an inflammatory pathway resulting in abnormal keratinocyte proliferation and psoriasis symptoms such as erythema, scaling, and itching. Anatomy of the skin. So the skin is our body's largest organ, consists of three main layers: the epidermis, dermis, and hypodermis. The epidermis, which is the outermost layer, is the skin's first line of defense, shielding from toxins, pathogens, and UV radiation. Inside the epidermis, Keratinocytes undergo the differentiation and the migration process that altogether form the protective outer layer of the skin. Under the epidermis is the dermis, which includes connective tissue, blood vessels, and nerve endings. The dermis provides structural support to the skin and houses important parts, including hair follicles, sweat glands, and sebaceous glands. Finally, the subcutaneous tissue, or hypodermis, is comprised of fat and connective fibers, working as an insulator and a shock absorber for the structures beneath. Knowledge about the intricate structure of the skin is essential for understanding how psoriasis influences this complex organ system and developing personalized treatments for psoriasis patients based on their particular needs. Physiology of normal versus psoriatic skin. In normal skin, the turnover of cells is finely regulated. Old skin cells shed and new ones come up to replace them in a precise manner. It keeps the skin barrier intact and efficient. But this process is disrupted in psoriatic skin, and therefore cells turn over too fast and keratinocytes proliferate abnormally, according to Armstrong and Reed, writing in 2020. As such, there is a buildup of immature skin cells on the surface that can be seen as shiny silvery scales. In addition, disorders of the immune system, and notably related to T cells and cytokines, further aggravate this process, leading to inflammation and excessive skin cell division. The physiological dissimilarities between the normal and psoriatic skin are key to developing specific treatments that target the underlying mechanisms causing psoriasis and relieve its symptom satisfactorily. Psoriasis can present in a multitude of clinical patterns, each with their own specific features which would have an impact on a patient management. The main characteristic of psoriasis is the development of red, scaly, thickened patches of skin, particularly on the extensor surfaces of the body, such as the elbows, knees, scalp, and lower back, according to Armstrong and Reed, writing in 2020. Varies in size, shape, and often accompanied by sensations of itching and burning, resulting in significant discomfort, to which affected individuals have dealt with. In addition to psoriasis being seen on the nails with changes like pitting, ridging, and discoloration, this can be increasingly demanding and may even lead to certain degree of functional impairment and psychological distress. Moreover, psoriasis can impact the mucous membranes, and this may be the source of discomfort and pain in areas such as the genitalia and oral cavity. The complex nature of psoriasis, which is characterized by various signs and symptoms, highlights the importance of a holistic medical evaluation by a dermatologist to assess disease severity and devise an individualized treatment plan. Diagnosis and differential diagnosis. Diagnosing psoriasis is a multifaceted task facilitated by a mix of clinical and dermatological examination. During a clinical examination, healthcare professionals very carefully examine the skin for any features which may be similar to that which is characteristic for psoriasis. These include raised, reddish plaques covered with silvery scales. Moreover, study of the nails for contours such as pitted and discolored features also may help with the diagnosis. Although skin diseases may demonstrate a wide range of clinical features, the final diagnosis may require special assessment by suitably trained professionals in order to confirm the diagnosis. Dermatologists rely on their visual acuity skills and can perform biopsies of skin tissue for microscopic examination, used in rendering a diagnosis of psoriasis case from the skin conditions. Differential diagnosis is important in that psoriasis should be differentiated from other conditions that resemble the disease such as eczema, seborrheic dermatitis, and a number of fungal infections. In this case, it is crucial to take into account the clinical characteristic and to consider conducting the diagnostic like skin cultures and patch tests if it is necessary. Treatment approaches. The treatment of psoriasis includes a wide range of therapeutic measures, which are designed to treat symptoms, reduce inflammation, and prevent progression of the disease, according to Bakshi et al., writing in 2020. For mild to moderate cases, topical treatments like corticosteroids and vitamin D analogs are the first step to relief, as they provide localized relief by reducing inflammation and stimulating regular skin cell turnover. Phototherapy, including UVB or ultraviolet B, and PUVA therapy or Psoralen plus ultraviolet A, is based on the action of ultraviolet light on suppressing the immune system and reducing the skin inflammation. In case of moderate to severe psoriasis where topical treatments prove insufficient, systemic medications such as methotrexate and biologics, which target immune dysfunctions leading to psoriatic inflammation, are then prescribed. The medications may be ingested, injected, or given intravenously, thereby resulting in systemic relief and improvement of skin symptoms. Besides that, lifestyle changes like stress management, identifying the triggers, and living healthy can help managing psoriasis symptoms and positively influence the quality of life. Patients' needs and support. Supporting patients suffering from psoriasis expands beyond the medical treatment to encompass the whole person and their life quality. Education becomes a powerful tool that enables patients to learn about their condition and the triggers and treatment for it. By giving patients information, healthcare providers are empowering them to participate actively in the management of psoriasis and to make optimal choices about their care. Nevertheless, psoriasis is not just a physical affliction, but also a psychological load for lots of people, which causes feelings of embarrassment, agitation, and isolation among them. Offering psychosocial support and counseling services can be instrumental in psoriasis patients overcoming their emotional difficulties and becoming more resilient. Moreover, the provision of a wide array of treatment choices, among them, like medications, phototherapy, and counseling services, cannot be overstated in addressing the different needs of the patients with psoriasis and in improving treatment success rates. Finally, routine care with a healthcare provider is essential to track disease activity, update treatment plans when necessary, and answer any questions or complications. In conclusion, psoriasis is a complex autoimmune condition that affects millions of individuals worldwide, presenting challenges not only in a physical health but also emotional well-being and social relationships. Through this presentation, we have explored the intricacies of psoriasis, including its definition, prevalence types, pathophysiology, and clinical manifestations, diagnosis, treatment approaches, and patient needs. By gaining a deeper understanding of psoriasis, we are better equipped to manage this condition effectively and provide support for those affected by it. It is crucial to approach psoriasis holistically, addressing not only the physical symptoms, but also the emotional and psychosocial or psychological impact it has on individuals. By working together to educate, support, and empower patients, we can enhance their quality of life and help them navigate the challenges of living with psoriasis. So let us continue to unravel the complexities of psoriasis and strive to meet the diverse needs of those living with a chronic cutaneous disorder. Thank you.